Welcome and good afternoon to everyone on the webinar today. We're excited that you're able to join us for this topic of using data to create action plans and what does that process look like and potential tools for you as well. So we hope that you enjoy the presentation. My name's Mary Ellen Kramer. I'm a senior health educator. And Hannah Smith will be presenting the webinar as well, and she's one of the health educators on the We Thrive team. So we're going to pull up the presentation so that you can follow along with us. So if this is your first webinar, we welcome you. There will be an opportunity at the end to ask any questions, but if you have any difficulties or can't hear us, feel free to type in the chat box that is on the left-hand side of your screen. So with that, we'll go ahead and dive into the presentation.
Okay, so I think a good place to start is to get into what is data. A lot of times that word can be really scary to people because we think of just numbers and analysis, and that's true, but it's simply put, it's just facts and statistics collected together for reference or analysis. So this can be quantitative, so dealing with a lot of numbers, or it can be qualitative information that is not numerical, such as open-ended questionnaires, interview, observations, etc. There are different types of data that can be collected depending on the project. So a few examples here is the community health assessment, which some of you may be familiar with. And this is a compilation of health data, recommendations, photos, and survey responses from community members that is then presented to the community to see what they want to work on. There are also community surveys. So there's the health and safety survey that we send to community members and residents so they can explain what issues they see are affecting their community. And then there's also team member surveys, so evaluation surveys that we send to the We Thrive teams to see how things are going with the initiative, what changes can be made for the program, what's working well, etc. So how do you use data? Good question. Data can be used in different ways depending on the project. And so for the purpose of this presentation, we're going to stick to 3 examples to highlight the difference in application for each. So we're going to be doing the health and safety survey, the change tool, and school tallies throughout the presentation. So health and safety surveys help address the health and safety issues affecting the area using community feedback. This is what I alluded to before. With the change tool, which stands for the Community Health and Group Evaluation Tool, it identifies nutrition, tobacco, and physical activity opportunities in the physical environment and in policy. Many of you have probably already done this as part of the chronic disease pathway. It's a very simple assessment that we do with teams. And then there are school tallies for students who walk or bike to school. And this is information that is gathered to see what transportation is used for children arriving and leaving school to help create a school travel plan for the Safe Routes to School initiative. And I'll get into that a little bit later. So here's an example of each one I just described. So this is the community health and safety priorities with the We Thrive. Again, you guys may be familiar with this if you have an upcoming community health presentation for your community. So as you can see, it's just a very simple survey. We use SurveyMonkey, so it can be done electronically or in person on a hard copy, and it just states very briefly, in your opinion, what are the most important health and safety issues affecting the well-being of your community. This is the example of the change tool that I mentioned. And again, many of you are familiar with this. And this is when health educators work with the We Thrive teams to identify what is in place in policy and the physical environment throughout the community from a series of questions. So based on the responses, each section is given a score between 1 and 5. For policy, a 1 means that the subject has not been identified as a problem, with a 5 meaning that there has been policy evaluation and enforcement. So kind of thinking as 1 as being kind of the worst and 5 being the best in terms of things being implemented. For the environment, it's the same thing with a 1 meaning no elements are in place for the subject, with a 5 meaning all elements are in place. So an example to help break this down is a question on the change tool is, to what extent does your community finance public parks or green spaces? So this can be tax levies, grants, etc. So if a community has an existing tax levy for parks, the score would either be a 4 or 5 because money has been identified and allocated to fund green spaces and pay for the upkeep. If the community has a lot of parks that are in great condition and have frequent maintenance, it would also be given a 5 for the environmental response as well. And the last example, this is a Safe Routes to School tally sheet. And this is used as part of the Safe Routes to School initiative. So just to briefly touch on what that is, Safe Routes to School is an Ohio Department of Transportation program where people can apply for funds to make physical changes in the environment, as well as education strategies to ensure that kids can safely walk or bike to school. And so part of that process includes these student tallies. So this tally sheet is given to the teacher, and it's used to see how many students are currently walking or biking to school. So the instructions say that you shouldn't do it on a Monday or Friday due to vacation or holidays, other reasons kids might not come back if they're sick over the weekend and still recovering on Monday, etc. You're not going to get the best results. So teachers ask students, very simply, how did you arrive to school today, and read each answer choice. So they say, did you walk, bike, take the school bus, use a family vehicle, carpool, etc. And each student raises their hand according to the answer that is appropriate for them. And the teacher records it in the tally sheet. And then the same questions are asked, but it's for how do you plan to leave for home after school. So really just looking at the arrival and dismissal transportation options that kids are already using. So once the data is collected and reviewed, after you've done all those things, you really want to see what strategies are best for your community. As we know, all communities are different, and certain things are going to work better for others. So you really want to consider what will have the biggest impact based on the population. And from there, you can identify the areas of growth. So again, this is all hypothetical, but going back to those 3 examples, the health and safety survey, the results may show that the biggest problem people view is heroin and substance use in their community. So this may prompt the team to consider the substance use and abuse pathway with We Thrive, which they could then work on having a drug take-back day. They could work with their police and EMS to create a quick response team for victims of overdoses, which then links them to services, etc. With the change tool, the results may show that there are no grocery stores in the area, or policies encouraging local vendors and concessions to list healthy options on the menu. So this may be a red flag to the team and may prompt them to encourage food providers to sell healthy, low-fat options, maybe at a pool concession stand, and post calorie counts to inform individuals on what they're consuming. With the student tallies, the results may show that 85% of students are taking the bus or being dropped off at school, despite 50% of students living only a half-mile away. So this is a big indicator of the importance of increasing walkability for students or having them ride their bikes to school, since so many of them live so close to school. This type of data will also make the application stand out because it shows that the funds could potentially have a big impact on a lot of children, about 50% of the school body. So the data here is really just going to drive your strategies and really help make the biggest impact in your community. But you also just want to keep in mind that the strategies should be policy systems and environmental change strategies to implement, because those will have the most long-lasting effects. So when you create solutions, you want to create the solutions, you want to identify the top areas of concern through the prioritization process, what we just touched on. So this will really help narrow in on what strategies you want to implement, but you really want to consider the following. Who is the target audience? Who do you really want to impact with these strategies? Will those target audiences in fact be impacted by what you're doing? Is the strategy feasible within your community? We want you to think big, but we also want people to be realistic in what they can actually implement within their community. Are the strategies culturally appropriate or acceptable for the community? You really want to meet the community where they are and not push something that's not appropriate for them. Who is at stake? You really want to consider that. And who has the power to implement the strategy? We all can't work alone. We really work with partnerships, so you want to make sure that the right people have the power to implement the strategy. So all things to consider when you're creating the solutions. Furthermore, with identifying strategies, you really want to do the ones that fall into one of these categories. So policy systems, environmental, or programmatic changes. You guys have probably been hearing about this a lot, and this is really what we're trying to do with We Thrive. So with policy changes, these are changes to laws, resolutions, or ordinances that can be done at school, state, or federal level. So an example of this could be a tobacco-free ordinance on all village property. So no tobacco use at all on any village property. System changes refer to how an organization or community operates. An example of this could be an organization designates a safe place for a woman to breastfeed. Environmental changes are changes to the physical built environment. So this could be creating bike lanes, creating sidewalks, crosswalks, things to improve walkability and encourage people to walk throughout the community. And then programmatic changes are around for a limited time and provide education to change behaviors, and a lot of times these support the bigger policy systems and environmental changes. So a common one people do are health fairs, so having blood pressure screenings, taking people's weight, blood sugar readings, things like that are kind of a one-time thing and can motivate people to get healthy, but they might not have those long-lasting changes for generations that we're looking for. So most of the strategies selected for your action plan should fall into a policy system or environmental category.
So additional information as we continue to identify strategies. So as Hannah has explained for us, we have data that is in multiple forms. There are multiple opportunities to collect data, both numbers about programs as well as qualitative, so quotes and feedback from residents or program participants. And then using that data to be able to really narrow down and come and select the topic. So you kind of Hannah talked through the prioritization process of the data and kind of how you help identify the top areas of concern. And then really what we're now diving into is you've identified your top areas, you are kind of thinking what you might want to do, but you're not sure what those strategies are. So that's what we're going to kind of share some resources that we have and things to kind of consider as we are researching strategies to help address the solutions or the concerns that you identified from the data that you collected. And taking into account what Hannah just shared in terms of who your audience is really important as you identify the strategies, because every audience is going to need potential different strategies. So these strategies are going to be the actual things that you are going to go and implement within your community. So strategies could be hosting a drug take-back day, implementing a walk-to-school event, trying to get a garden within the local school or child care center within your community to be able to provide fresh produce to the kids. So as we're trying to figure out what these strategies are, here are some things to keep in mind. So there are lots of example strategies that exist that are evidence-based, and we're going to go through a couple potential websites on the next slide of what those example strategies look like. When we talk about evidence-based, we really want to look for strategies that are evidence-based, and this is because this strategy has been tested multiple times, and it's been shown to have an impact. So not all of our strategies are going to be evidence-based, but we definitely want to try to identify a couple that are evidence-based. Sometimes there may not be an evidence-based strategy for what you're looking for, and you might have to kind of go out and create the wheel or start a new program. But it's always great to be able to look at what other communities have done and build off of that and look at what's been successful, so that you can identify strategies that will be successful within your own community. When you're searching websites, you always want to look for websites that end with .gov or .gov, and then also look for websites that end with .org or .org. So these are going to be the most trusted websites that are out there. They're going to be government websites, either from local or state or federal government websites that have done research and shown what these evidence-based strategies are. The .org websites could be local health departments. They're also going to be nonprofit organizations or large foundations that really have a stake within the concerns and issues your community has identified. We're also here to help, so you can run your ideas by your health educator to see, like, hey, this is what we've identified as a concern. Here's what we're thinking about doing. What are your thoughts? And Hannah, Kim, and I are always happy to help and kind of talk through with you what potential strategies could be. And then lastly, as you're finding these strategies, you might have to modify them to best fit the needs of your community and or your target audience. And that's going to be up to you and your WeThrive team to figure out. And it's okay if we have to modify it. We want the strategy to be the best example and the best strategy that's going to work within your community. And as Hannah said, every community is different, and you know your community best. And so you are going to know what strategies work and what strategies are not going to work, and how we might have to change a strategy that we found that's evidence-based to make it work within our community. So here are some examples of websites or locations that you can use to help find potential strategies to use within your community. So the first one is called What Works for Health, County Health Rankings and Roadmaps. And this actually comes from a foundation, the Robert Wood Johnson Foundation. And so if you go on this website, you have the opportunity to search for evidence-based programs or strategies that are around health behaviors, so tobacco cessation, increasing physical activity, clinical care strategies, maybe such as accessing health care or bringing healthcare providers into your community, social and economic factors, such as crime or violence, or looking at a community policing strategy. And then lastly, the physical environment, so strategies around improving sidewalks or getting lighting in, improving parks. So there's a ton of resources on that website. I was on there earlier this morning, and it's really easy to navigate. You can search a ton of different ways, and lots of programs and strategies come up. And a lot of these strategies are the policy systems and environmental strategies as well, which is great. The next potential place is the National Registry of Evidence-Based Programs and Practices. So this is put on by the Substance Use and Mental Health Association, so the government that works strictly on substance use and mental health. And so if you're looking for strategies around substance use or programs, maybe such as the Drug Take Back Day or having a drug lockbox that individuals can drop old drugs off within your community, this is a great website to look at to see what some of those strategies are and how information has been used and shared with the community. Mental health is a huge part of overall health and well-being, and so it's definitely important and something to consider as you are looking at your data and you see that mental health problems could be a potential concern. This national registry is another great place to find those evidence-based practices around mental health. The Promising Practice Network programs that work. The goal of this network is to improve the lives of children and families. So you're going to find evidence-based strategies that deal specifically with children and families. So if that's who your target audience is, then this could be a good website to start at to look for some of those potential strategies to use within your community. And then the last one is Find Youth Info, which actually comes from the federal government. And this has everything and anything you've ever wanted to know about youth. So evidence-based programs, from education and making sure they stay in school to social programs for them or physical activity programs. So everything and anything you've wanted to. So it's another great resource, especially if you've identified youth as your target audience or one of the target audiences that you would like to address. Definitely a good starting point. So now what? So you've collected your data, identified your areas of concern, your target audience, what problem you're trying to solve, and then you've identified the strategies or the actual things you want to go and implement. So now what do we do? So now this is the part of where we develop an action plan. And an action plan is the blueprint for how you will implement those selected strategies within your community. There are lots of different formats of how an action plan could look like, but they all have the same basic components. So what you're going to see today are the action plans templates that we use within the We Thrive initiative. If you have additional funding from other sources, this may look slightly different, but the concepts behind it are exactly the same. Having an action plan is really helpful because it will outline what you need to do to be able to reach your overall goal. It will help you stay on track and make sure that you're making the progress that you said that you wanted to make to reach that overall goal. Action plans are also really helpful for celebrating those small successes along the way. Sometimes it can seem a little overwhelming or a little daunting to be able to reach that strategy of increasing the number of students who walk to school, by 25%. So if you have 100 kids in your school, you want 25 more kids walking to school. That can seem a little overwhelming, but within the action plan, you're going to outline the steps that you're going to take to be able to get to that ultimate goal. And so as you achieve each of those steps, your team and your community can celebrate those steps because that shows the progress that you're making. So there are kind of some key components of the action plan. And so those are the objective, your key action steps, the person or persons responsible, what resources are needed, the target date, and the measure of success. So now we're going to dive a little bit deeper into each of those components. So the objective. The objective is the main goal for your action plan. What are you trying to achieve? What is that big picture that you're trying to achieve within your community to help address the concern you identified within the data that you reviewed and or collected? You want your objective to be SMART, which means it should be specific, measurable, attainable. Could you actually get to that? Realistic, will it work within your community? And time-bound, which means by when are we going to get this done? So a sample one would be by December 31st, 2016, Hamilton County Public Health will engage 2 new We Thrive communities. So this objective is SMART because it's specific. We're going to engage new We Thrive communities. It's measurable because we're going to engage 2 communities. It's attainable. We feel like we have the resources and personnel to be able to engage 2 new communities. It's realistic. We think within a year, we can engage these 2 new communities. And it's time-bound because we said by December 31st, 2016. So I know sometimes trying to make objectives that are smart, can seem, a little overwhelming, and that's okay. We've been doing this for a long time, and there are still times that I have to stop and think and be like, okay, is this truly smart? Is this a SMART objective? So if you ever have questions about your objectives, you can always reach out to your health educator or to any of the folks that work with us at the health department. So after you've identified your objective, you're going to identify your key action steps. And as you think about your key action steps, you're going to list out step by step, how are you going to achieve that objective? The more specific the action steps are, the more helpful they will be. So potential, let's say that our objective, kind of sticking with the safe routes to school, is by May of 2017, 25 more kids will walk to school within the Southeast School District, or the Southeast Elementary School. So how are we going to achieve that? What are some of those key action steps? So we might want to do some education. So we're going to send flyers home to parents that explains the importance of walking to school. Maybe we need to look at the policies within the school district to make sure that they support students walking and bicycling to school. So that's a key action step. We're going to create a program that encourages kids to walk to school. So for every day that they walk to school, they get a ticket that enters them into a raffle. So those are just some examples of potential action steps. But that's what you want to list out. Everything that your team and your community wants to do to be able to get you to that objective that you described. So then for each of the key action steps, you're going to have the following 4 things. So the first one is the person or persons responsible. So this is going to be the name of the individual or individuals who will be in charge of making sure this step is completed. Having specific names on it, so saying that Mary Jo Smith and the principal are going to be in charge of the key action step of reviewing the policies is better than saying the whole team is going to be responsible, because then you have individuals who are responsible, and ultimately they're the ones that are going to work to make sure that that key action step gets done. They may ask for help from the team or from other folks, and that's perfect and great, but those folks who are listed as the person responsible is who's going to get that action step done. So then the next one is resources needed. So within this one, you want to list out all potential resources that will be needed to complete that key action step. So when we talk about resources, we want to think about, are there any financial resources that we're going to need? When we're creating a program that encourages kids to walk to school, what are those prizes? We're probably going to need some financial or some money to help purchase those prizes or a donation from someone. The resources could also be time, so time of the team members that it's going to take to achieve that key action step. It could also be supplies that you need, or meeting rooms, or contact information. So resources can be really broad, and you want to think through what all is going to be needed to achieve that key action step so that you make sure that you have all of those resources. And if you don't have one of the resources, then we can figure out what we need to do to get that resource. So then you also want to identify a target date. So this is the date that the key action step will be done. And so as you're working through each key action step and building up to that ultimate objective, you want the dates to kind of be progressive. So maybe the first step is, due 3 months into the project, and then the second step is due 6 months in. You don't want all the dates to be the end of the objective period. You definitely want them to be spread out throughout the time frame that you're working in. And then lastly, you want to identify the measure of success. So how are you going to know that you completed this key action step? Or if someone is looking into your community team or watching or helping out with your community team, how are they going to know? So if you're looking at the key action step of educating parents, then the measure of success is the flyers went out in a mailing from the school district. So it doesn't always have to be, this big measure of success, but you want to be able to track and identify how are you going to know when that's completed so that everyone is on the same page. So here is a sample action plan template that includes all of the components I just talked about. So you have the objective on the top of the kind of grid-looking box, and then on the far left, you will list out all of your key action steps, and then the rest of the boxes you'll fill in for each of those key action steps. And so again, as you're building out your action plan, your ReThrive Health educators are definitely here to help and provide support. So feel free to reach out to us if you have any questions or need support. I know sometimes it can be a little overwhelming to think about an action plan and developing it, especially if we're trying to develop a 2-year action plan. It seems like a really far off time period, but that's okay. So kind of just try to break it down as much as you can and look at, okay, what do we need to do within the next couple of months, and list those things out. And then kind of think about, all right, once we get those things done, what are the next big steps? And it's always important to remember that your action plan can be a fluid document, which means if you have to go back and make changes, that's okay. Maybe there's a key action step that you forgot, or the timeline that you had doesn't really match up with the community and what's realistic and feasible. Maybe there's resources that you didn't realize that you need. And so going back and making those changes is what's going to be helpful and keep your team on track as you are trying to implement your action plan. So now you have your action plan and the fun work begins. Now you get to actually kind of walk through your action plan that you just created and begin to implement those key action steps that you identified. And so this is all with the goal of creating those healthy changes within your community. And your community could be your school, your faith-based organization, the community that you live in, the community in which you work. Any of those are, when we talk about community, is what we mean. And then the last piece that you want to think about is evaluation. And how can we evaluate that overall objective and see the progress that we're making on a larger scale? Evaluation could definitely be a key action step so that it's built into your action plan and your team remembers to do it. For some objectives, you may be able to redo the data collection method you did in the beginning as a way to evaluate the objective. So for example, you did the student tallies to identify how many kids were coming or walking or bicycling to school on a daily basis. You found out that there was really low rates of kids. Most kids were riding the school bus, or getting dropped off. So then after a year of kind of implementing your program, you could redo the student tally as a way to evaluate your progress, and hopefully you'll see that more kids are walking to school than when you started. This is also true for the change tool or any of the assessments that we utilize within the We Thrive initiative. It's a good way to kind of go back and measure your success because you should see some changes in those scores. Evaluation doesn't necessarily have to be done every year. It could be in every 2 years. It's just going to be dependent on the action plan that you develop as well as kind of the timeline that's developed within the community. Oh, and look at that. I just went through the evaluation example of using the safe routes to school. So here you can see, again, everything that I just talked about in terms of trying to increase the number of kids who are walking to school. So as we wrap up for today, just a few points for the overview. Data plays an important role within the We Thrive initiative and the work that you do. And hopefully through this presentation, you've realized that data doesn't have to be this big thing or these big scary numbers, that sometimes, that there are these other ways to collect data, and there's opportunities for all of the We Thrive teams to be able to review data and create action plans. You can then utilize your data to help identify priorities for your team to work on. And then lastly, the data can also be used to evaluate the work or the work that your team has been doing or the impact that your team has been doing as well. So again, we hope this presentation has been helpful and kind of an introduction into looking at data, the different types of data, data collection, how we might be able to collect the data, and then also how do we identify what we're going to work on within our community? How do we identify those areas of concern and then identify those strategies that are going to help address those areas of concern within our community? And then the final step is then just developing that action plan so you have a blueprint of how you're going to implement those strategies within your community with the goal of ultimately seeing that improvement in the concerns that you identified. So with that, we will open it up to see if there's any questions. If you are on the phone, you may have to hit *6 to unmute yourself so that we're able to hear you. Otherwise, you can type in the comment box on the left-hand side of your screen. So there doesn't appear to be any questions. So with that, we're going to end the presentation and the webinar. If you think of other questions after you kind of review and digest the information shared, feel free to reach out to the health educator for your community, and we will be able to help you out. So thanks again for joining us, and we hope that you have learned something new and something that you'll be able to take back to your community and the We Thrive work that you are working on. So we will talk to you later. Thanks.
Bye.